place of the pain, for example. So we must learn the anatomical term. All description of the human body are based on the position of the body or anatomical position. If you remember, I described the anatomical position when you stand erect and your face and your palm of your hand, okay, directed forward. This position, like this, okay. I described all of this in previous lectures, okay. This position is called the anatomical position, and if you lie on the back in the ground, okay, on the ground, this position is called supine, and the opposite position when you lie on the abdomen, for example, it's called prone. So the general position of the body when you stand or when you're lying, okay, it's called anatomical position, supine position, and prone position, okay. And if you remember, I described some plans that passes from the body. The first plan that passes from the body is sagittal or median sagittal. If you remember, the median sagittal is a vertical plan that passes from the body and it can divide the body in two equal half, right half and left half, okay. And by this sagittal plan, we have some terms like medial and lateral. Medial point of the body describe the point of the body or structure of the body that are nearer to the median sagittal plan, okay. And the structures lies far from the median, it's called lateral. Medial, lateral, okay. And there are several paramedian or parasagittal plans that lies parallel, that passes parallel to the paramedian or median sagittal, and it can divide the body in two non-equal half, okay. So this is the median sagittal plan. The other plan that passes from the body is coronal. If you remember, is the other vertical plan that passes from the body and divided the body in two half, anterior and posterior, okay. I described the anterior and posterior terms, if you remember, and their equal terms like the ventral and dorsal in trunk area. In trunk area we can use the ventral against the anterior, for example, or we can use dorsal equal to the posterior, only in trunk region, okay. The other plan that passes from the body, if you remember, is called horizontal or transverse. Horizontal or transverse plan that divided the body into half, upper and lower, okay. And if you remember, there are two terms, superior and inferior. Superior indicates the structures that lies upper than the transverse plan, and inferior describe the point of the body that lies down to the transverse plan, okay. In previous lecture I talked about this, and if you remember, I described the axis that passes from the body, And the axis, the importance of the axis is about the movement, because the movement occurs around this axis. Okay, for example, AP axis is a line. It passes from anterior, it enters to the body from anterior, and it exits from the body from posterior. Okay, like this line. Okay, and some movement like abduction and adduction, if you remember, it occurs around this line, this axis. Okay, the other axis is bilateral, like this line, or this line. Okay, it's called bilateral. And some movement like flexion and extension, it's occur around the bilateral, flexion, extension. And the other axis is called vertical. That means this line, vertical line or vertical axis. The rotation movement is occur around the long axis or the vertical axis. Okay, and if you remember, I talk about the body or body is formed by some system. Okay, for example, a skeletal system. The bones of the body forms the skeletal system, and the other system, muscular system. Cardiovascular system is formed by the heart and vessels. Digestive system, okay, for eating, for example, respiratory system, urinary system, reproductive or genital system, nervous system, endocrine system, that's formed by some gland that produce the hormones and release this hormone to the blood, okay? And the skin, we can categorize the skin in the system of the body. Okay, and if you remember, in previous lecture I talked about the skeletal system, and I described the different type of the bones in the body, like this. You saw this picture in previous lecture. Okay, the bones that forms the skeletal system. Okay, there are the different type of the bones, long bones, short bones, for example, and flat bones like this, okay, and irregular bones like the vertebra, irregular bones, irregular in shape. Okay, and in this table I described the different of bones. For example, the axial skeleton, that includes the skull, the bones of head and neck, the cranium and face, okay, and auditory ossicle in the internal ear, and the vertebral column, okay, and the sternum and ribs that form the chest. All of these forms the axial skeleton. And appendicular skeleton describes the bones of the upper limb and lower limb, okay, and I describe and I name all of these bones in previous lecture. And we reach to the muscles, if you remember, the muscular system. And in this picture you can see two views of the muscle of the body, anterior view and posterior view of the muscle in our body. And in our body there are three types of the muscle: a skeletal muscle, cardiac muscle, and a smooth muscle. I describe all of these. The skeletal muscle are the muscle that attach to the bones, like these muscles attached to the bones. but the cardiac muscle is special for the heart or heart. It's formed by cardiac muscle, and isthmus muscle is the other type of the muscle that form the wall of the digestive system and internal tubes. Okay, here I talk about the skeletal muscle. Each muscle usually has two ends. One of these ends has a little movement, so it's called origin. And the other end of the muscle, this muscle, has more mobility, okay, is mobile, for example, and it's called insertion. So, attention please, the skeletal muscle has two or more attachment, usually two attachment, and in some muscle, yes, some muscle has more attachment. The attachment that moves the least, okay, is referred to as the origin, and the one that moves the most is called insertion. Okay, and each of the muscle usually has a belly, a thickness part of the muscle that formed by the muscle fibers. It's called belly. So there are three terms: origin, belly, and insertion. Okay, origin, belly, insertion. The end of the muscles in different muscles, for example in flat muscles, forms a different type of the insertion. It's called aponeurosis. Okay, occasionally flattened muscle are attached by a thin but a strong fibrous sheet. It's called aponeurosis. And in the other muscle, for example, in flat muscle that join to each other, okay, between the muscle fibers usually forms the raphe, like this. A raphe is an interdigitation, like this. Interdigitation line, zigzag line. Okay, interdigitation of the tendinous end of fibers of flat muscle. So you can see the different insertion of the muscle: tendon, aponeurosis, and raphe. The most muscle forms the tendon. The flat muscle forms the aponeurosis, and some of the flat muscles forms or inserted as the raphe. Okay? When the end of the tendon collected and forms a cord-like bond, is called the tendon. Aponeurosis, raphe. Okay, describe the end of the different muscles. And in this picture you can see the different type of the muscles. Okay, for example, some of muscles has different shape, like rhomboid or quadrilateral strap, and for example the belly part of the muscle is like a fusiform, or some muscles has two belly, or is called digastric. It has two belly. Some of the muscle have the two head. It's called biceps, two-headed or biceps, and some of the muscles are triangular. The other muscle have a pennate shape, unipennate, or the bipennate shape or multipennate shape. And in this picture you can see the relaxed or contracted muscle fibers. Okay, and if you remember, in previous lecture we reached to this table, the factors we use for naming of the muscle, of the skeletal muscle. Okay, so this table describes the naming of a skeletal muscle. There are the different factors for naming of a skeletal muscle. What is this factor? The position of this muscle, the function of this muscle, and the attachment site of this muscle, and the other factor. Okay, this table shows this factor. For example, shape, size, number of head or belly, okay, position, depth, attachment, and action. All of these are factors for naming of the skeletal muscle. For example, shape. Some muscle like deltoid muscle are triangular, like the deltoid muscle that cover the shoulder. Okay, deltoid muscle that cover the shoulder. Or some muscle called tres. Tres, that means round. Tres, that means round. According to the shape of this muscle is called tres. Or rectus, that means straight. The muscle fibers arranged straight. The size of the muscle is the other factor for naming of a skeletal muscle. For example, large pectoralis major, for example, or pectoralis minor, or broad, like latissimus on the back, or the longest, okay, like longissimus. Longissimus, that means longest. The other factor is number of head or belly. For example, biceps. Biceps, that means the muscle has two heads. Triceps, forceps. Triceps, that means the muscle has three heads. Forceps, that means the muscle has four heads. Digastric, that means this muscle has two belly. Okay, or according the position of the muscles, we can naming this muscle, position or location of the muscle. For example, pectoralis, okay, pectoralis, that means the muscles lie in pectoral region. Or for example, the gluteus muscle, okay, or supraspinous. All of these describe the position of this muscle. According to the superficial or depth of the muscle, we can divide it, or we can naming the skeletal muscle. For example, superficial flexor and deep flexor, okay, or for example, external, internal muscle, external oblique, internal oblique, involve the abdomen. Okay. The other factor is attachment. Attachment of the origin and insertion of the muscle. Okay. We can use for this attachment for naming the muscle. For example, in each side of the neck, there are two muscles. It's called sternocleidomastoid. It's attached to sternum clavicle and mastoid process. Okay, like this, sternocleidomastoid. Okay, from sternum and clavicle, its origin from sternum and clavicle, and ended or inserted to the mastoid process. And action of the muscle, action or function of the muscle is the important factor for naming of the skeletal muscle. According to the function or action of the muscle, for example, flexor, extensor, okay, elevator, depressor, okay, all of these indicates the action of this muscle and is important factor for naming the skeletal muscle. Okay, this picture shows the deltoid muscle. You can see the deltoid muscle is triangular shape. Deltoid muscle that covered the shoulder joint in each shoulder. Okay, deltoid. Look at this triangular shape. Or, for example, this muscle around the eyes or around the mouth. Okay, it's called orbicularis, like a circle, like a circle. It's called orbicularis, orbicularis. Okay, orbicularis oculi, orbicularis oris. Okay, or for example, in glottal region, in glottal region, there is three gluteus muscle, gluteus, according to the location, gluteus. According to the size, there are gluteus maximus, gluteus medius, and gluteus minimus muscle. In glottal region, there are three muscle is called gluteus, gluteus maximus, medius, and minimus. Okay, or in front of the arm, you can see this muscle. It's called biceps brachii. Biceps, that means this muscle has two heads, short head and long head. Okay, so it's called as biceps. Or this muscle is called coracobrachialis, according to the attachment of origin and insertion of this muscle. Coraco, that means this process is about the scapula bone. Coracoid process. Attention please, this muscle origins from coracoid process and inserted to the humerus. Okay, so it's called coracobrachialis muscle. Okay, or this muscle, according to the root of the muscle fiber, rectus abdominis, or in lateral wall of the abdomen, obliquus, externus, obliquus internus. Okay, according to the depths of the muscle, or this muscle in lateral side of the neck, sternocleidomastoid. This muscle, it's named according to the attachment, sternocleidomastoid muscle. Okay, or this muscle between two ribs. The other name of ribs is costa. So this muscle called intercostalis, intercostal muscle, external intercostal, internal intercostal, external, internal, and innermost intercostal muscle. Okay, all of these are about the naming of a skeletal muscle. Okay, and in this picture you can see the diaphragm. Diaphragm is a broad muscle that separates the chest and abdomen. Okay, it's important for respiration. Okay, after we review the muscle or muscular system, the other system in our body is called cardiovascular system. Cardiovascular system. Cardio indicates to the heart, and vascular, that means the vessels. Okay. And the other name of cardiovascular system is circulatory system. You know that the blood is circulated within the vessels, okay, by the pressure that formed by the heart. The blood circulated within the vessels. And there are three types of the vessels in our body: artery, vein, and very small and microscopic vessels called capillary. Okay. This picture shows the schematic shape of two circulation of the blood, two system of circulation of the blood. Okay. The systematic circulation, and the respiratory or pulmonary circulation. Okay, and you know that the heart has two halves, right half and left half. The right half is circulate the deoxygenated blood, and the left half circulates the oxygenated blood to the body. Okay, for example, the left ventricle, when contracted, circulates the oxygenated blood to the body, to the general body, and deoxygenated blood is collected by the vein and reach to the right atrium. Okay, and then by the contraction of the right ventricle, deoxygenated blood reach to the lung for exchange the gases and receive the oxygen, and finally oxygenated blood circulates and reach to the left atrium, and it drains to the left ventricle, and by the artery it circulates and reach to the other part of the body. Okay, and you can see here the circulation of the blood in two different systems. This picture shows the arteries of the body. What is the artery? What is the meaning of the artery? Okay, look at here. The artery vessel transport the blood from the heart and distribute it to the various tissue of the body, okay, by means of their branch. That means the artery maybe contains the oxygenated or deoxygenated blood, okay. For example, the pulmonary artery contains deoxygenated blood from the right ventricle to the lung, okay. Circulate the deoxygenated blood to the lung, okay. It's called pulmonary artery. So the artery indicate the vessels that transport the blood from the heart to the other organs, okay. This vessel is called arteries, like this. For example, this is the aorta from the left ventricle is transport the oxygenated blood to the organs, but here this is the pulmonary trunk or pulmonary artery from the right ventricle of the heart transport the oxygenated blood, okay. What is the vein? The other term, the other type of the vessel in our body, veins, okay. Veins are vessels that transport blood back to the heart, okay, back to the heart. Many of them possess valves. The smallest veins are called venule. The small vein called venule. Like the small artery, for example, the branches of the artery is called arteriole. Arteriole venule, okay? Arteriole venule. So, the vein are the vessels that transport blood back to the heart, okay, like this. Finally, superior vena cava and inferior vena cava, okay, transport blood to the right atrium of the heart. And in this picture you can see the smallest vessels. It's called capillary. In one end of the capillary, it's connected to the artery or arteriole, and the wall of the capillary is very thin, and the oxygen and the nutrient, for example, can transport to the cells, okay. And the other end of the capillary is connected to the venule that collect the deoxygenated blood from the tissue, okay. And the venule join to each other and forms the large vein, okay. Look at here. In this picture shows the capillaries that located near the cells in each tissue, like the connective tissue. One end of the capillary connect to the arteriole, and the other end is connected to the venule, okay. In arteriole end of the capillary, the hydrostatic pressure of the blood is high, and this pressure is formed by the heart by contraction of the left ventricle. The hydrostatic pressure is high in artery and arteriole. The wall of the capillary is thin, okay, is thin. So the water of the plasma can passes from the wall of the capillary and can enter to the tissue, okay. within the tissue, this fluid is called interstitial fluid. Interstitial fluid, okay? The oxygen and nutrients can reach to the cells, and when the blood lost the water is concentrated by some proteins like albumin, and after concentrated here, the osmotic pressure becomes more in venule end, and this osmotic pressure can drain back the water to the venule, okay? So from the arterial end, the water of the plasma can exit from the vessel to the tissue, and in the other end the water can come back to the venule by osmotic pressure, okay? The quantity of the water, quantity or amount of the water, quantity of the water drawn back into capillary, drawn back to the capillary, is often less than that which was forced out. The amount of this water is less than of this water that forced out, okay? Normally, this excess fluid does not accumulate in connective tissue, but drain occasionally into lymphatic capillary. Look at here. Within the tissues, there are some very thin and very small ended capillary, okay, capillary called lymphatic capillary. The lymphatic capillary collect additional fluid of interstitial fluid, the fluid between the cells within the tissue. Additional fluid is collected by lymphatic capillaries, and it forms the lymph. It forms the lymphs, and finally, this lymphs, after filtration by the lymph node, drains to the large vein in the root of the neck, okay? So this amount of the water is come back to the vein. So this fluid is called the lymph, okay? The lymphatic system, the other system in our body, is called lymphatic system, okay? I describe what is the lymph. The lymph is the additional fluid within the connective tissue or the other tissue is collected by the lymphatic vessel. You can see in this picture the lymphatic vessels, the small lymphatic vessels, for example, in upper limb. These vessels passes from the lymph nodes and filtrated here. Usually the lymphs contains the antigen, and this antigen usually destroyed by the lymphocytes or macrophages within the lymph node, and the filtrated lymph exit from the lymph node, for example here and here in axilla. And finally, the filtrated lymph drains to the large vein at the root of the neck, okay? You can see these lymphatic vessels within the thorax, for example, it's called thoracic duct, drains the lymph to the subclavian vein at the root of the neck. In the right side of the right upper limb and right head and neck, usually the right lymphatic duct, a small right lymphatic duct drains this lymph to the right subclavian vein. Okay, and within our body there are some lymphoid tissue. What is the lymphoid tissue? The lymphoid tissue is a special connective tissue that formed by accumulation of lymphocytes. What is the lymphocyte? You know that the lymphocyte is a type of leukocyte of the blood. Leukocyte of the blood. One type of the leukocyte of the blood is lymphocyte. The accumulation of the lymphocyte, okay, within the body, it's formed the lymphatic tissue. For example, the tonsil around of the mouth or around the pharynx, or a spleen, okay, is the largest lymphoid tissue, or lymph nodes in axilla. These organs called lymphatic organs or lymphatic tissue. Lymphatic tissues are a type of connective tissue that contains large number of lymphocytes. Okay? Lymphatic vessels are tubes that assist the cardiovascular system in the removal of tissue fluid, okay, from the tissue spaces of the body. The vessels then return to the fluid to the blood. Okay, this is the lymphatic vessels, and the lymphatic organs helps the immunity of our body. The leukocyte, like the lymphocyte, okay, involves the immunity of our body. Okay. Okay. The other system in our body is nervous system. Nervous system. The nervous system, this contains the central nervous system, includes the brain and a spinal cord. Brain includes two hemispheres, right and left. It's called cerebellum, and brainstem that connect to the spinal cord. The spinal cord is lie within the vertebral column. Okay, so this part of the nervous system is called the central nervous system, or in abbreviation we called it as CNS. Central nervous system. Okay, there are the other part of the nervous system. It's called peripheral nervous system. Peripheral nervous system indicate the nerves, cranial nerves and spinal nerves. There are 12 pair of the cranial nerves and 31 pair of the spinal nerves. Okay, 12 pair of cranial nerves and 31 pair of the spinal nerves that reach to the other organs, okay, and reach to the muscle or internal organs. It's called peripheral nervous system. Peripheral nervous system, okay. The central nervous system, CNS, is composed of large number of nerve cells. The other name of the nerve cell is neuron. Okay? The neurons forms the nervous tissue. The nervous tissue. Okay? And the neurons usually supported by specialized cells called neuroglia. The neurons, the main cell, attention please, the main cell within the central nervous system is called neuron. And this neuron supported by a specialized cell called neuroglia, like astrocytes and the other neuroglia cell. Each neuron usually has the cell body or pericardium, contains the nucleus and the cytoplasm, and it has some process that exit from the cell body, okay, from the pericardium. The short process is called usually dendrite, and the neuron has only one long process. It's called axon. Short process, dendrite, one long process, axon. Okay? And the body of the neuron is called pericardium. Okay? And I talk about the peripheral nervous system. The peripheral nervous system consists of the cranial and spinal nerves and their associated ganglia. There are 12 pair of cranial nerves. 12 pair of the cranial nerves, and there are 31 pair of the spinal nerve. That means these nerves exit from the spinal cord and reach to the muscles and the other organs, for example. Okay? And in addition of the cranial nerve and spinal nerve, there are the other system. It's called autonomic nervous system, contains the sympathetic fibers and parasympathetic fibers. Okay? In this picture you can see the 12 pair of the cranial nerve. Okay, and you can see the name of these 12 pair of cranial nerve. For example, the first cranial nerve is olfactory. Okay. The second cranial nerve is called optic. The third is called oculomotor. The fourth is called trochlear. Number 5 is called trigeminal. Number 6, abducent. Okay. Number 7 is facial nerve. Number 8, vestibulocochlear. Number 9, glossopharyngeal. Number 10, vagus nerve. Number 11, accessory nerve. And finally, number 12 is called hypoglossal nerve. Okay. Here, I try to review the name of this nerve. Okay. And in neuroanatomy, you will learn about this nerve, and in head and neck anatomy, you will learn all of this. Don't worry. Okay. And look at the color of these nerves. Some of these nerves shows by the blue, this shows by the red color. Okay, the blue color indicates the sensory fibers, and the red color indicates the motor fibers. Some of the cranial nerves only contains the sensory fibers, and some of the cranial nerves only contains the motor fibers. But some cranial nerve contains both of the sensory and motor fibers, and 4 of the cranial nerves contains the parasympathetic fibers in addition to the sensory and the motor fibers. Okay, so this picture shows the cranial nerve, and this picture shows the 31 pair of the spinal nerve. The spinal cord can be divided to the 31 segment, okay, or segment or piece, and each piece or segment has 1 pair of the nerve. For example, there are 8 segments in the neck. It shows by cervical nerve from C1 to C8, cervical nerve. Or in thoracic part of the spinal cord, there are 12 segments and 12 pair of the spinal cord is called as T1 to T12. In lumbar region, L1 to L5. In sacral region, S1 to S5, and only 1 pair as coccygeal nerve. Okay, each of the spinal nerve exits from the intervertebral foramen. Between 2 vertebrae in vertebral column. Between 2 vertebrae, there is the intervertebral foramen. Is a site for exit of the spinal nerve. Exit of the spinal nerve. Okay. So we review the nervous system. Okay. You can rest for 5 minutes. After 5 minutes, I will back and I will continue.